So the patient is sitting on the chair and we're giving them a local anesthesia, and immediately we see that the patient develops skin rashes. What do we do? In this situation, there aren't any actions we can carry out to solve the problem. Instead, we can only use different types of drugs to help decrease the hypersensitivity reaction and eventually stop it. The first type of drug is an antihistamine drug, and the second type of drug is corticosteroids that tame down the immune response and help stop the hypersensitivity reaction. We give these drugs at two specific times in this situation. Number one is immediately after we've stopped giving the drug, or immediately after we've observed the skin rashes. And second is after the patient has gone home, and we'll take these drugs at home according to how the doctor has prescribed these drugs to them. Skin signs due to hypersensitivity reaction can present itself in two forms. Number one, with delayed onset, and number two, with immediate onset. Delayed onset skin signs can present itself in the form of erythema, urticaria, pruritus, and angioedema, whereas immediate onset skin signs can present itself as erythema, urticaria, and pruritus. In case a patient shows delayed onset of skin signs, first, we're going to stop all procedures or the administration of all drugs presently in use, and we're going to go to our handy-dandy emergency drug cupboard and take out Benadryl 50 mg or chlortrimetrin 10 mg, and we're going to administer it to the patient intravenously or intramuscularly. Then we'll refer the patient to a physician as well as prescribe oral antihistamines such as Benadryl 50 mg 6 hourly or chlortrimetrin 10 mg 6 hourly. We can also prescribe a tapering dose of oral corticosteroids such as prednisone or methylprednisolone dose pack. In case a patient shows immediate onset of skin signs, that is considered to be more severe than the hypersensitivity that causes a delayed onset of skin signs. And so we're going to add an extra precaution to the steps of management for this patient. Now, along with the administration of antihistamine drugs, we'll also administer corticosteroids. So we're going to go to our handy-dandy emergency drug cupboard and take out 100 mg of hydrocortisone or 8 mg of dexamethasone or 125 mg of methylprednisolone. Along with this, we'll also monitor vital signs of the patient and consult the patient's physician. Before sending them off for home, we're going to observe them in the clinic for 1 hour. So to summarize, first, we make an initial decision which includes administration of a drug. Then we monitor the patient and consult the patient's physician to get all relevant details. Lastly, as treatment, we prescribe drugs to the patient to take at home.